Welcome to TCNtalks, an Anatomy of Leadership. We continue our conversation with Kathleen Benton and Teri Yarbrow in part 2 of Virtual Reality for Serious Illness, Connecting, Healing, and Inducing Awe. And now, here's Chris Comeaux.
Let's talk about the evidence, because there might be a couple of, kind of skeptics.
I just have to jump in and say a couple of things about what you're saying about psilocybin.
Yes.
And that is that there's a lot of research, or the beginning of research, about the fact that your brain in a deep immersion in VR is the same as your brain when you're on psilocybin. It's not quite ketamine, but I'm a proponent that if you're having a bad trip, you can take your headset off. Not the same if you're microdosing under supervision. You got to wait till it's over. So I'm excited about the idea that a lot of VR is called technodelic or cyberdelic, because it has the same qualities of some of these psychedelics without some of the negative side effects.
That's actually really cool framing, Teri, because I was kind of wondering if virtual reality is the best term to take this into the future. It might take something a little bit sexier, just to move people's thinking, because it's so rooted in gaming. And again, the first time Kathleen said it, I'm like, what? But I think a framing like that might be a brilliant way. Well, let's go to the next segment and let's talk about the evidence, because I do think there'll be some people like, okay, well, what is the evidence saying? So what evidence are you guys seeing with the immersive experiences? Pain, anxiety, distress. I know Kathleen well enough to know that she what's the data say? And so I'm curious, what does the data say?
Yeah, and it's a great question, because it is important that we get a little serious about this and explain this is not fluff. This is not just beautiful. This is not just an added extra. What folks are doing with this across the world is very real. And the data behind it is very real. We're actually talking about tens of hundreds of thousands of articles, peer-reviewed articles that have now been written on virtual reality in medicine. You spoke when you introduced Teri about one of the conferences she and I have both gone to, VMed, to speak. VMed is in LA. It is one of the founders is a GI physician from Cedars-Sinai. You're talking about 7 years ongoing research he started on his IBS patients, but has published an entire book on VR and medicine. So we're talking to you today specifically about hospice, palliative, and pain. But beyond that, virtual reality is being studied at every level of medicine. And the conferences that are going on are robust. And frankly, America's even a little behind the curve, because what I saw in Europe, where it's not fee-for-service medicine, is just gangbusters research. In fact, the physician who I visited in Barcelona has a government-funded, he is a physician with a full-time position just practicing with VR. So he is overseeing these 14 sites in Barcelona dedicated to cognitive therapy and pain and palliative medicine and virtual reality. He's not even seeing patients individually anymore. So the research is there. Teri and I did our own as well. We wanted an opportunity to take patients in the Southeast, go through an institutional review board, and do our own. I told her again and again, because she wasn't in the healthcare realm at the time, I think the best way to start all this, Teri, we've done the pilot project with the students in VR for Good, and we've seen the interest, the PR, all that, but let's be credible. And the way to be credible in medicine is good research. So we utilized my palliative clinic, outpatient clinic, with the partner hospital that I work with, and we did this work for over a year. And we had over a 90% success rate, with the ability to negate pain, to bring folks down on pain medications, not with specificity with dosing, but rather just in general treating the pain. One neuropathic patient who could get zero relief after several months of us trying a myriad of drugs, only received relief from VR. We actually ended up giving her Teri, did all this intervention and gave her the headset. I think the person who was most grateful was her husband, to Teri, for actually bringing her relief at her end of life when she started in palliative care and eventually advanced to hospice. So we saw that pain and we saw the data behind it. More is now being done in that kind of research. I am trying right now to join a trial over in Spain, which was a big reason I went to go talk with this physician, because they're using it not only with the headsets, but you think about maybe dementia patients or patients who just feel claustrophobic with the headsets on. They're doing immersive rooms, so that the VR is actually projected onto the wall and don't even have to wear the headset. So they've advanced past that concern. But the thing that Teri and I found in our research that I feel we have to mention is the piece that we didn't expect. And that's always the best part of research, when you do your hypothesis and you're sure of what you're going to find, or you're hoping what you're going to find. And then you find this thing that you didn't think of at all. And that was the component of spirituality. That was that we had really more patients vote. We had to ask them where their pain was on the pain scale. And we did do that before and after. We used that measuring tool. But what they would vocalize without being asked is the meaning, the purpose, and the spirituality that they found through the content that Teri was feeding them, especially in the radiance, the luminous light that she was able to put them in front of, that they were not having anxiety over their death or over the chronicity of their disease, that they all of a sudden were, like she said earlier, and those were even non-patients, were not afraid to die anymore, that they saw their purpose in the world. It was the most amazing spiritual experience, again, despite the personal beliefs of the patient. So the research is absolutely there. And certainly as a part of this podcast, beyond linking you with the book, we can link. Teri is an encyclopedia of the wealth of research that's available to folks and ongoing on virtual reality and healthcare.
Teri, what would you add?
Well, I want to just mention the American Medical Extended Reality Association. Okay. That's the AMXRA. I'm a founding member. I believe Kathleen is too.
Right.
And this is an organization like the AMA, which is, it's set up for standards. It's set up to provide research. We have a journal of extended reality. And there's so much research that has gone prior that this is why the FDA has given a designation for medical extended reality. So we're in a way, we're no longer talking about the viability of it because it's already been proven. It's been proven in hospitals across America. One of the starter hospitals is Lucille Packard Children's Hospital out of Stanford. Every child who's admitted there is given a VR headset. So they're able to do a lot of procedures without having to anesthetize a kid. And I'm not talking about surgery. I mean, like getting a child ready for surgery. You could put them in a VR headset and they'd be playing a game. They wouldn't even know that they were getting ready for surgery, right? Because let's face it, it's a form of distraction therapy. A lot of suturing happens. There's less need for medication. There's less need for anesthesia, or the levels are brought down. So Stanford has really been like at the forefront. There's a hospital in Tel Aviv. It's called Tel HaShomer. It's almost like a whole city hospital that's devoted to VR therapy. And the reason I know about this is my teaching assistant at SCAD, she had MS. I didn't know she had MS. She woke up one day and the whole side of her body was paralyzed, and she went to Tel HaShomer Hospital and they gave her VR therapy and they taught her to walk and to feed herself. And it's amazing how much work is being done. And it's not just pain. A lot of the work that's going on in Barcelona that Kathleen was mentioning is about physical rehab. And in fact, the physical rehab section of VR therapy is the first that it's gotten its FDA designation. So you have a lot of companies that are FDA approved. They have a series of exercises and experiences and the way of tracking it. And it's all a write-off. I mean, it's all an insurance bill back. So,
wow.
Yeah.
Now I'm just thinking like I should have done this podcast way sooner. I'm so glad we're doing this because I mean, when I'm learning, that's when I know this is solid gold. Well, the other thing that bumped into in your book that I'm like, I hadn't even thought about that either, that not only helping patients, but also caregivers and clinicians. So can you guys speak to that? How can immersive experiences helping people that are working in our space, burnout, emotional fatigue, those are things that have always been an issue in our space, but feel like it's reaching certainly a crisis or epidemic level throughout healthcare, much less just an end-of-life care.
He did a study on that. So on burnout and healthcare workers. And the reason it came up is because when I was looking into this projector device, so I would have this in place for my potential PACE patients in cognitive therapy, he made the point, buy the smaller projector so you can move it around because you can actually load content specific to burnout and healthcare workers and use it in your respite staff room. And of course, we all have break rooms. So the meditative therapy in VR has already shown its worth in that space directly. So that's the piece of, I would say, direct research in burnout. But the indirect piece is that this VR tool, what I see in my nurses or social workers or chaplains who bring it into the practice is that it works like a partner tool in their own therapy. So, for example, they're there assessing and documenting and doing all the regimen and things we're all involved in on the day-to-day in the bedside. And then they get to offer the patient or the caregiver something that really lifts them up. Number one, it just is it's a feel-good situation for them. Number two, when they're immersed, and especially as it becomes habitual, maybe not the first or the second time, but if it's a regular therapy, they're documenting while their patient is enjoying an intervention. So there's really multifaceted purpose for using this as a tool for a clinician, both directly and indirectly in patient use.
Well, a lot of times bringing VR to a hospice patient, if they're actively dying and their eyes are closed, they're not a candidate for VR. However, the room is full of family members. Some of them are just grieving and are inconsolable. Sometimes they have their children with them. So walking into a hospice session like that and letting each member of the family try VR, it's amazing. It's transformational. And when I use the word transformation, there's a term that's been coined about inducing awe, and that's STEs, or self-transcendent experiences, which is what awe can do. A little bit of awe, you can transform somebody's experience about their mortality. But you can also help. I mean, the reason that virtual reality studies are saying that it's cyberdelic or technodelic is that it's expanding a kind of, how do I say this? It's expanding this boundary. There's the ego, and that ego is so afraid of dying and letting go, right? But if they could have a little taste that they're not so separate from the universe or God or whatever you want to call it, this is like the beginning of maybe healing that final wound. I'm dying of cancer. Why me? Why at this time in my life do I have this? And a self-transcendent experience can really change that end-of-life experience. So, and if we can't get to the patient, before they're doing the act of dying, we can certainly help their family members cope a little bit better. And I think that that's what, a little bit of awe can do for our, walking into a room like that.
This might be a segue question, but hospice has always been about honoring someone's story. And you alluded to this earlier, but how might immersive storytelling through VR allow patients to reconnect with their life story or their legacy? I feel like you kind of took it in a way there, Teri, but I feel like there might be another angle here that you're alluding to earlier related to people's legacy or life story. Or is that another maybe frontier of as you think of how this goes forward?
There are a number of groups that are working with VR and legacy stories and storytelling. One company can take a patient using Google Maps through a journey back to the significant places of their past. They can go to the church where they got married. They can go to the school where they met their husband. They can go to the home that they were raised in. So some of that is really, it's called reminiscence therapy. So that is very powerful for unlocking memory for Alzheimer's patients, dementia patients, but also music is as well. As far as in creating storytelling for patients, when I was doing hospice volunteer work, when I first met Kathleen, I was doing work of doing end-of-life videos for patients, where a patient would communicate some final wishes, and maybe the video wasn't shown to the family until after they were transitioned. So that might have, a lot of potential using a VR camera, a 360 camera, so that you could put somebody into the scenario of really sitting with somebody that's starting to impart jewels of their life, what they've been through.
That's amazing. It's just the possibilities as my mind gets thinking about this. I'm so glad you said that too, Teri. There's someone else I want to connect you guys with. So if we look forward 10 to 15 years, do you think that VR is going to become a normal part, or is this still going to be kind of a niche innovation? What do you guys see?
I mean, if we have anything to do with it, it will become a normal part because, I tell a lot of hospices because we try to advocate, both of us. Teri was really doing the work and working with them. And me, I just met with one out of Oklahoma. I don't know, last Friday, I think it was, just to say, this is not rocket science. Anyone can learn this. They need to be trained on how to do it. They need to use the right content and not just get off the internet what's there. And they need to have the right prompts for the patient. Beyond that, the grants available for this technology are abundant. And any of us in the nonprofit world, I can tell you donors are thrilled to fund something this unique. So starting a first program, you should just dive in. That's how I do everything. But at least in this one incident, you should take my advice and just dive in. Because even if you house it in your volunteer department and have 3 interested volunteers that train on it, alongside your volunteer coordinator or manager, that's a great start at a $5,000 effort. It could be a $5,000 effort. I think it will become utilized everywhere because I see the use right now in the aging population growing. We've got to find interventions for our demented population as the baby boomers just take over. And of course, with the baby boomer takeover will come more and more dementia. We've got to find therapies that work with the brain in a different way. And I see what's happening in Europe. And over there, they aren't just using it for pain and palliative and healing. They're using it for cognitive therapy towards better executive function as dementia progresses. So you're talking about even through dementia worsening, a patient's functionality heightening because of virtual reality therapy. So, if we don't get behind it because it's beautiful and the right thing to do, I think we'll get behind it as caregivers because we've got to find something to help these folks be more independent for longer in what could be an 11-year illness.
I'll add that I think that the VR headsets will really radically transform. A lot of our elderly patients, their faces are so fragile, and putting on this big mask, a lot of them don't want anything on their face that's that heavy. And I think that that's where this big push right now with Apple and Meta and Samsung and all the manufacturers are really going towards AI glasses or AR glasses, really trying to find something that's lightweight that sits on your face. My feeling is the difference between AR and VR is the immersive quality. So you really need something that's going to have at least 180, but that could be so much more lightweight. And I really think, in the next 5 to 10 years, we're going to see the headsets go away. We're going to have lightweight glasses. I think we'll also have contact lenses, retinal implants. These implants will probably have content. I could talk about brain-computer interfaces, but I think that there's leaps and bounds in this area. So the VR headset is like a dinosaur, It is. It's this clunky thing that you put on your head, but it's magic. And I think that the race is on right now to find a more comfortable device for our patients.
You've both alluded to this throughout, but is there going to be like a library of content that perhaps programs like ours will subscribe to? Is that where we're headed? Because you said, I'm sure there's free stuff you could download, but I'm like and maybe this is the categories you're alluding to, Teri, but there's recreational things, there's transcendent content. It feels like there's these kind of flavors of different content. So is that where we're headed, as like a library? And is that something you guys are working on?
Well, this always comes up at these VR conferences, and that is, it would be great to have a VR pharmacy where, content is shared and a doctor can say, I want you to go, kayaking in Iceland for half an hour. And then, if you still feel a lot of pain, then you can take your Oxy. Hopefully that's not the drug of choice in the future. But VR pharmacy would be phenomenal if people could share content.
That's incredible. Well, ladies, my mind is blown, which is a great sign of a great podcast. I'd love to give both of you the opportunity. Final thoughts that you have.
I love that Europe is so advanced, so pro using the power of the brain, incorporating that into medicine. I think that having our health care system, really caught up in fee-based and all the bureaucracy. Where we were really pushing for humanity, to put the human back into the experience, to put the patient back in the experience. VR is kind of it's kind of a device. That's all it is. The magic is really in the intent. The magic is in who's doing the therapy, right? And I don't know. I'm excited about the future because I think that there's a lot of people that are aligned with this kind of work, and maybe for the moment it's not widespread or it's niche, but I don't think it's going to stay that way.
I would just say that healthcare is hard, and I don't think it's poised or positioned to get easier. I think it's just going to continue to be heavily regulated and scrutinized and audited. And we're going to, as I tell my leaders, always say we're not staffed appropriately, what we always used to feel was appropriate. So finding creative, unique, powerful interventions like this is a gift. And I'm excited to be able to be excited about something new, a program that can be put in place easily, that can really change the trajectory of an illness or the trajectory of an end of life for a patient. And I just would encourage looking into it, researching it, reading a little bit about it, and reach out to one or both of us to just feel like you've got a resource in your country that is doing this in your field and wants great partnerships to continue to do that work.
Wow. Well, ladies, any links you want, link to the book. Teri, if there's certain research you want us to link folks to, your contact information, anything you want, because I have a feeling this is one people are going to really be interested in doing some good follow-up. I'm just sitting here and just thinking just the providence of you two coming together. Kathleen, I kind of knew the story of your brother, but to think about how you shared that part, Teri, your amazing creative superpowers, and you two coming together as this great dynamic duo, bringing this into this space. I just want to high five you both. I think this is going to be a much listened to, paid forward show just because I think you're plowing new territory. But as I listen to you guys, I'm like, why does someone, like we had a presentation, Kathleen, you might remember maybe 3 years ago, MPHI, of a little bit of immersive experience, but it wasn't applying it the way you two are applying it in end-of-life care. So I just want to high five you both and encourage you. I think this has got huge potential. And I'm so glad, Kathleen, you mentioned it as in passing, and I made a note. I'm like, she's writing a book. We need to do a podcast on that. I'm so glad that we finally got together on it.
Yeah, he even called me out. He said, whatever happened with your book? I said, what do you mean? I wrote it. It's done. And he said, well, I thought you were going to maybe tell me that I can buy it. I said, Chris, I'll just send you a copy if you really want it. But so we did, and here we are. So thanks for having some faith in us.
Absolutely. And again, I have a copy here. We're going to include a link for our listeners. So again, thank you both. Yep. And for our listeners, we want to thank you. At the end of each episode, we share a quote, a visual. The idea is to create a brain bookmark, a thought prodder about our podcast subject. This is going to be a fun one to further your learning and growth and thereby your leadership. We're hoping it sticks. It's like we're looking for a brain tattoo with this brain bookmark at the end. Be sure to subscribe to the channel. This is going to be a podcast you're going to pay forward to your friends, your coworkers throughout the hospice and palliative care space. You know, it's easy for us to rail against the world and be frustrated by things. Let's be the change that we wish to see in the world, just like Kathleen and Teri coming together. So thanks for listening to our podcast, and here's our brain bookmark to close today's show.
VR gives patients back what illness takes away: presence, identity, and agency. By Teri Yarbrow. Thank you, USI, for sponsoring this podcast.